I'm here today to talk to you about the cancer plan, which was released in September this year. And this Victorian Cancer Plan 2020 to 2024 sets out the government's policy and reform agenda. It's underpinned by 5 core principles which inform the priority focus areas it identifies to ensure that Victorians have the best outcomes and experiences of cancer care. For this event, I'd like to emphasise 3 of these: quality and safe care, that is evidence-informed, and that is person-centred and with a focus on equity. And in terms of the cancer plan, it has the tagline of improving cancer outcomes for all Victorians. So another thing for you to perhaps keep in mind. It builds on the previous plan and continues the long-term vision and goals, retaining the 5 action areas of primary prevention through to research. There are a few things that are new though. This includes the addition of some short and medium-term goals and the embedding of the optimal care pathways, which are linked across the action areas and within each of the actions. So what are the optimal care pathways? They'll be familiar to many of you. Some of you have been involved in their development. But they set out the key principles at key steps in the pathway of care. They reflect and embed emerging areas of optimal practice, and they've been developed by a multidisciplinary team of experts, gone through rigorous and extensive consultation and endorsement through peak bodies, professional groups and NGOs. They've been endorsed through national interjurisdictional processes and by peak Australian cancer control agencies like Cancer Australia and Cancer Council Australia. There's some images here. They're currently being refreshed. So the prostate cancer one has not yet been designed. But I have left in the quick reference guide from the high-grade glioma summit, because you can see it looks a little bit different. So we're looking forward to those being released in 2021. So the OCPs are designed as a guide to optimal care for all involved in the system of care. As a short digression, this is a slide from Professor Bob Thomas, who's also been involved heavily in this program of optimal care pathways. And it just reminds us that care pathways are not clinical practice guidelines. So the optimal care pathways are about the organisation, processes, policy development, and the creation of a framework or system of care. Under the cancer plan, the reform agenda is centred on the optimal care pathways. And that means that it's centred on all of you here, patients and clinicians and healthcare administrators, because the optimal care pathways have been developed by all of you, for all of you. And it's a reform that starts with measurement of the system against the optimal care pathways, where the optimal care pathways are a clear guide of what should be for us to compare against what is. And that happened in the first summit. So we are actually in a repeat. So there has been a program of work in terms of quality improvement and implementation in the intervening period. There's a range of stakeholders and resources and other initiatives which are identified here on this slide. And they've been engaged and developed to support the entire reform process. And the tumour summits are a key part of that. The program was first conceived back in 2014, and it's matured since that time, where it's been reviewed and refined at each step. It's now a program of work which starts with a summit, collective discussion, and focuses on potential achievable and meaningful work for improvement at the statewide level, and sometimes too at the local, because there may be particular areas of need in different integrated cancer services. It's followed by a repeat summit, such as today's, and the measuring and monitoring of change is important. So it will be very interesting to see what may have changed in the intervening period, COVID-19 notwithstanding. Coming back to the cancer plan and the short, medium and long-term goals it set, achievement of these goals will take coordinated and sustained effort across the sector by all of us. These tumour summits contribute to that. So as you deliberate today, please keep in mind what more can be done to make a meaningful difference, the scale of change needed, what are the lessons learnt from our improvement work to date, and how can we continue to measure and monitor and make sure that we are making a difference? Events like this don't happen on their own, and there's a whole lot of people who have been involved, and I'd like to acknowledge and thank them all on behalf of the department, and in particular the clinical working group chaired by Jeremy and Damien. Thank you all, and I hope you have a great day today. Thank you. And I look forward to the hearing about the outcomes and what more work we need to do.